Hey everyone, we are going to do a quick birth prep circuit that you can do any point throughout pregnancy when you are looking to help open up your pelvis, relax your pelvic floor, or just stretch out in the morning or at the end of the night. All you need is a yoga block. So let's get into it. So we're going to be starting on all fours and we're going to get into some quadruped rock back. So we're going to start the first 5 with our toes in and our knees out. As we sit back, we're going to take a nice inhale, relax the pelvic floor, and then exhale. Squeeze and lift as you come up. And again, inhale, let everything relax on the way back. Squeeze and lift as we come back to our starting point. We are going to do 5 of these in this position. And again, really think about letting that pelvic floor relax and drop down, and then squeezing and lifting like an elevator when you come back to the starting position. Now to hit some other points of the pelvic floor, we're going to turn our knees in and toes out as much as you can comfortably. And again, nice inhale as you sit back. Exhale on the way back up. And again, inhale. And then exhale. With those exhales, you also want to think about, as you're coming up, drawing that core in and bringing that baby to your spine. So again, nice inhale. And then exhale. Everything is squeezing and lifting as we come back to the starting point. Next, we're going to get into some cat-cows with our pelvis offset with the yoga block. So we'll start with our right knee under the yoga block. We are in that traditional cat-cow position, but we're going to shift our weight over to that right leg. And then as we are arching, we are taking a nice inhale, letting that belly relax, hang down, letting that pelvic floor relax, feeling a nice stretch in the back of the pelvic floor. And then exhale. Rounding, feeling a nice stretch through that low back, engaging that deep core. And again, inhale and exhale. So you're going to do 5 of these with the yoga block under your right leg. When you hit 5, we are going to slide it on over under the left and repeat again. So with that inhale, everything is arching. Belly is nice and relaxed. Pelvic floor is relaxed. Feeling a good stretch back here. And then exhale. And inhale. And exhale. Good. We can move the yoga block to the side until later. We're going to be in a half kneeling position, so we'll start with that right leg up. Left arm is going to go up towards the ceiling, and we are shifting our body over towards that right leg. You also want to think about squeezing that left glute. That's going to help you feel an extra stretch in that hip flexor. We are releasing tension in the hip flexor, the round ligaments under the belly, and in the lat. And you are just going to hold this here for about 30 seconds or about 3 to 5 breaths, really, whatever feels good for you. If you feel nice and loose after a few breaths, you can move on. If you feel like doing longer feels better, you can hang out here a little bit longer. With those inhales, you're still thinking about letting that pelvic floor relax, making sure you're not keeping it clenched. Now we're going to turn our leg out to the side, and we are going to rock to stretch that pelvic floor, feeling a nice stretch through our inner thighs and coming back. So nice inhale. Exhale. We're going to do about 10 of these. 3, 4. Feeling a good stretch in this right inner thigh, in the pelvis. If it feels good to have that leg out long, you can bring it out long. Really, whatever feels good for you and your body. We are stretching on out. We're going to keep that leg out long. We are going to bring our left hand down to the ground. Right hand is going to come out. We are opening up, feeling that nice stretch through our thoracic spine and our ribs. And then we're going to thread the needle under, rotating the other way. So you should be feeling this mostly in that mid back, not in your lower back, not in your neck. Feeling a nice release. We're going to do 10 of these on this side. When you get to about 10, we are going to switch And now we will have the left knee up, and we're going to repeat those 3 exercises on this side. So left knee is up, right hand up to the side, up to the sky. Squeeze that glute. You're going to immediately feel a little bit more stretch in that hip flexor. And we are shifting over to the side, feeling a nice stretch through all of here. When we're done, bring that leg out to the side, and we are going for that inner thigh stretch. Again, you can keep that knee bent a little if it feels good to extend it out long for a stretch here. Feeling that nice stretch through our inner thigh, through the pelvic floor. We are helping opening up the pelvis here. Get you ready for childbirth. And you're going to do 10 of these. And then when you hit your 10, that leg is going to stay out long. Right hand goes down to the ground. Left arm out long. We are opening up through that mid back. If you can't get too far, that's okay. Just work with whatever comfortable range you have. As your pregnancy progresses, you may find you get a little tighter through your mid back with just all of the changes that your body goes through. But you want to keep working on that thoracic rotation. That's just going to help with everything from back pain to posture, neck pain, keeping everything moving up there. Good. Okay. Now we are going to be standing on the yoga block, so we'll start standing with it on our right foot. So we're going to put that yoga block right under the right foot, keeping that knee slightly bent. We are going to reach down and rotate left hand to right foot 10 times. You should feel a nice stretch and release through the back of the hip and the pelvic floor. So you're going to rotate this way 10 times. So right now we are introducing some internal rotation of that right hip and pelvis. You're going to do 10 times that way, and then 10 times right hand to left foot. So what I'm doing here, and I'll show you from the side on my other leg, is we are doing that hip hinge, sitting those glutes back to the wall. When you hit 10 of those, we are going to flip it to the other foot. The yoga block is under my left foot. I'm going to show you from the side. So we're going to do 10, rotating opposite arm to yoga block foot, sitting those hips back, feeling a nice stretch through here. Good. And then we're going to rotate towards that other leg, really feeling the stretch through that glute. Next up, we are going to get into a lunge stance, and instead of dropping right down to the ground, as we lunge down, we're going to rotate, again, similar to how we just did with that yoga block, rotate our body towards that forward foot. Again, we are getting a good stretch through the back of the hip. We're loading our glute, lengthening the pelvic floor and those deep rotators. 10 of these. And then when you get to 10, we will switch sides, rotating through here. Really thinking about sitting back into that glute. Feeling a good burn back here, maybe. Good. We're going to finish up doing some deep breathing in a deep squat. So you can either sit, if you can deep squat all the way down to the ground, you can do it that way. If you need that yoga block for a little extra support, you can sit on the yoga block. And we are just going to hang out here, doing that deep 360 breathing. So taking a nice deep breath in, letting that pelvic floor relax, and exhaling. So you can also use that yoga block for feedback. So as you inhale, you should feel a little bit more pressure from your perineum area into the yoga block. As you exhale, it should squeeze and lift away from the block. So again, nice inhale, and then exhale, squeeze and lift. So you can do these for about 5 to 10 breaths, and then we can even just finish up with a quick little rotation in that deep squat, especially if you're on that yoga block. This might be a little more challenging if you don't have the yoga block under you, but just really opening up that mid back some more. And there you have it. So give those a try. As always, don't push through any discomfort and get clearance from your healthcare provider.